I'm Edward Gordon-Smith, and I'm a retired haematologist and emeritus professor of St George's, the University of London. My particular interests have been in aplastic anemia and the non-malignant bone marrow failure syndromes of all sorts, and most of the rest of non-malignant haematology. Not so much clotting, of course, but the bone marrow disorders and hemolytic anemias.
Who or what events inspired you into going into hematology and inspired you to take this path into your career?
It certainly was a long time ago, but I know perfectly well. I'd always wanted to be a hematologist, funnily enough, after I'd decided to go into medicine, partly because it's in those days, one of the specialties where you really could combine science and the laboratory with clinical work, and both in the laboratory and in the clinic, the other side influenced how you managed things and what you did in the laboratory. And it was a terrific idea. And I was lucky enough to, after doing my preclinical training in Oxford, to go to the Westminster Medical School, now defunct, where there was a fantastic collection of scientists, pathologists, and clinicians who had been drafted in to make it a very important part of the University of London, where this combined idea was preeminent in your training, and it was marvellous. That was a good start.
And what would you say the moment that defined your career?
It's been such an interesting and exciting thing that it's hard for me, and I've sort of thought about this, to pick out any defining moments. I was 20 years at the Royal Postgraduate Medical School at Hammersmith, learning science and the excitement of introducing science into the clinic and back again. And there were so many really exciting moments there, not just in haematology, but in many other specialties, when I was able to go to St George's and establish a unit specifically for the treatment of patients with aplastic anemia, and a research group to study the basis of why the bone marrow fails and how the bone marrow works, actually, and to recruit really quite eminent and excellent people to help run the show.
What do you think are the challenges that's facing the old or the new generations in haematology, or what are the challenges in haematology?
There has to be the question of how much further does immunotherapy go for the treatment of malignant disease. That's one of the major things. Questions about blood transfusion and blood products and how they are best managed. How we interact with other specialties which are changing at such an immense speed. And one thinks about, for example, obstetric haematology. Certainly 40, 50 years ago was panic stations when there was major hemorrhage and so on. But now there's much more understanding of how to manage major hemorrhage in obstetric practice and in trauma, of course, which will be something for haematology to consider in the future, how best to manage it. At least I guess that will be one of the things.
You spoke about the achievements and getting the lab results on the hands of the hematologist so quickly that we can manage our patients. But do you think there are other achievements that we should be speaking about in the past 60 years in the hematology?
Automation is a tremendously important step, together with actually the quality assurance schemes that emphasize the importance of accuracy in haematology. In large parts of the world, the lack of proper quality control makes it very difficult to practice haematology in a way which is very helpful to the patients, even to the extent that it's very difficult to measure hemoglobin, as you know, without the machines that we're fortunate to have now. I think the invention of monoclonal antibodies, which impinges on all aspects of haematology, must be one of the seminal discoveries which have advanced our specialty, both in the lab and in the clinic together. And then, of course, there's the question of things like stem cell transplantation or bone marrow transplantation. Don Thomas and his colleagues in Seattle were a fantastic achievement, which, together with many immunologists, Jan van Rood, for example, in Holland, opened up a great understanding of the immune system out with the work of the immunologists, if you see what I mean, part of the science of bone marrow transplantation.
How would you see the workforce of hematology in years to come?
There is a threat that hematology, or a scenario that hematology might be subsumed into a number of different specialties, and as we know it, disappear. But I hope you and your generation will make sure that it carries on exactly as it is, with the excitement of the science and the clinicians, clinical, going side by side.
What do you think we as hematologists have to do to attract more students to specialize in hematology?
I think, how do we attract people in? By showing them what a fantastic specialty hematology is, and what fun we can have, as well as what good we can do to our patients, and how exciting to see all these new advances that are coming through might be applied to our patients. I mean, gosh, when you think we've got gene therapy, cast G cells, monoclonals, and different treatments, how exciting it all is. And of course, hematology spills over and sticks its little fingers into every other specialty, and that makes, for me, a really interesting and exciting part of the specialty.
And what do you think about the guidelines that the BSH sets for hematologists?
I think it's difficult to do that. That's a bit rambling, because I think the BSH has done a terrific job in producing guidelines. I just want to say that it is difficult, and they're not holy books. They should be considered what they are, guidelines.
So how do you think the BSH can play a role in shaping the hematology in the future?
Well, the BSH in the past has been terribly important. I mean, it was to make all people from the ivory towers down to the smallest district general hospital feel that they were part of a society, all working together for the benefit of patients, ultimately in the discoveries of blood diseases. And in part also by encouraging all hematologists to join in the clinical trials, which the MRC ran. And again, that was inclusive. Everybody felt that they were playing a role in improving the lot of patients with mainly malignant diseases, of course, to do that. And I think the BSH will, and I hope it will continue in such an overarching role to bring us all together, whether we're in the science lab, the clinical lab, or the service lab, or the service side, and keep us working together in the way that I've hinted we might be pushed apart if we weren't kept together.
So what do you think the most important step in the future of hematology will be?
Of course, the big thought at the moment is that, and the evidence is that there is an autoimmune function causing aplastic anemia, and that it is T-cell mediated rather than antibody mediated. But the target isn't known, and it's not clear whether it's the stem cell, the niche, or where else it might be that the inhibitory antibodies are acting. And one has to explain why aplastic anemia can recover spontaneously, almost completely. So there are lots of things in aplastic anemia. It has been a very good specialty for me, and I'm very glad to hand it on, or that's passed on to colleagues who worked with us throughout the time, and it's a very exciting field, that.
And from experience, what would be your advice to the new generations?
You have to know about your specialty, you have to know what you're doing, and you have to understand how the knowledge has been produced. The second thing is to be able to work with colleagues to deliver that knowledge. And the third is, of course, to have an empathy with patients. But if you don't have the first of them, all the rest fails. So one has to, unfortunately, work quite hard. Fortunately, it's much easier to gain knowledge nowadays, of course, and you can use the internet and the teaching and what have we in order to do that. But you cannot skimp learning about your specialty.
Thank you very much, Professor, for talking to me today.
No, it's been a pleasure, and it's very nice to see you and to see the future of haematology, and I wish you well in all that you do.